Ciao Cesare,
Ciao Ingrid.
te sei primo. Così mi hanno detto questi ragazzi. Non sono stata io a scegliere, eh?
Non sono io, sono stato io il primo a chiedere di essere il primo.
Cioè, la prossima volta ci inviti a noi andare con te dove essere che tu vai, Non sappiamo dove vai, però non vogliamo essere con te, va bene?
Va bene, va bene.
Adesso incominciamo. Ah, e così, no, no, no. English. I'm so happy to have you both guys here. You are icons in what you do. We look at you with admiration. We follow you, and Guido is already part of my life, right, Guido? And Cesare is about to be soon, so I can call you friends. So let's start, Cesare. Do you have ready your presentation?
Yes,
Okay.
I'm sharing my presentation. I hope that everything is prepared. Okay, can you see my presentation?
No.
Yes.
No aquí. No. No, pero. Okay, now yes. Okay. Okay, Cesare, we can see your
Okay.
presentation.
Okay, perfect.
Thank you, Ingrid, again for the invitation. It's always a pleasure to share some experience with friends like Guido, like Mariano, like Pablo, and all the people in the auditorium. Today, I have to speak about the characteristic of the different laser in dusting or fermentation. These are my conflicts of interest. And if we take a look at the guideline, we can see that the only two lasers that are present in the guideline are the holmium laser, that is for sure the older laser in the guidelines, but also the TFL. And these two kind of energy are together with the pneumatic ultrasonic and combined system, the energy source for the stone treatment in the different surgeries. If we consider the three different lasers, we can see that regarding the wavelength, the lower is the wavelength, more absorption is into the water, and consequently, we have a less penetration depth with more vaporization, more coagulation, and less retropulsion. Means that the different lasers are more photomechanical effect if the wavelength is higher. So holmium is for sure the laser with more photomechanical effect, and the other two lasers are less photomechanical effect, more photothermal effect. When you consider a laser, we have to consider two different characteristics. One is the period, and the other are the frequency. The period is the time between one pulse and the other one, and the frequency is the number of the pulses in time. And regarding the different setting, we have to understand that if we decrease the period between one pulse and another, we can have some complication, especially regarding the temperature. The two lasers that we consider today prevalently are the holmium laser and TFL. Two lasers that are absorbed in the water, but more the TFL, so with less real penetration depth, with more photothermal effect, and holmium more photomechanical effect. And we start our experience with the laser on these two parameters, energy and frequency. But after some years, we have also the pulse length. The pulse length is a very, very important parameter because is inversely proportional to the peak power. That is one of the most important characteristics of the laser. And if we consider these three parameters, we can see that the potency is not important in the setting, but what is important is the frequency, the energy, and especially the pulse length. Increasing the pulse length in the holmium, we decrease the peak power, so we have a more dusting effect. And the peak power is the maximum instantaneous optical power in one single pulse. And you can distribute this power in a short time or in a long time with really two different effects. If you consider in this drawing the different peak power, you can see immediately that the peak power of the TFL is around 500 watts. The peak power, the standard holmium, is from 2000 till 12,000 watts. And the other parameters are, for example, for the Moses technology, we have these two bubbles with a peak power around 1,500, 2,000 watts. For the thulium Young pulsed, we have a peak power intermediate between the holmium and the TFL. But what does it mean, the peak power? If we have a higher peak power, we can increase the retropulsion. We have a more fragmentation effect. With the low peak power, we can increase the dusting effect, we decrease the retropulsion. And this is really evident in the characteristic of these two different lasers, but I think that you know perfectly. But I want to underline what is very important regarding the frequency and the pulse length, because with the TFL, we have a very, very good advantage because we can decrease the energy till 0.025 joule, and this is the way also to treat small, softer stone and doing a very good dusting. The limit of the classic, the standard holmium is that the 2000 watts of minimum peak power is too strong, was too strong for make a good dusting in the softer stone. With the TFL, we can do this. With the holmium today, we can do the same or quite the same with the magneto, but is a particular holmium. And with the TFL, on the other side, we can have a very high frequency. When TFL arrived in the market, was defined super thulium, because of this characteristic, to increase the frequency till 2200 Hz. But increasing this characteristic, we had in the first time some complications, especially in the ureter, due to the fact that decreasing the time between one pulse and the other, we don't give the time to decrease the temperature of the water around the stone. And regarding the different way to do the lithotripsy, we can see that with the holmium we have this photomechanical effect due to the shock wave of the bubble created on the tip of our fiber, and this can break the stone with really a good fragmentation effect. Enlarging the pulse length, we can decrease this shock wave effect, decreasing also the diameter of the bubble, decreasing the energy, and having also a good dusting. But on the other side, the TFL has more thermomechanical effect. What does it mean? That the TFL created, touching the stone, an explosion of the water inside into the stone. And this micro explosion of the water permitted to break the stone in very, very small pieces. And with this kind of effect, we have also other effects that are not effective for the lithotripsy. One is the retropulsion. The other one is the producing of this light that sometimes we can see during our lithotripsy, and eating the fluid. And this could be a problem. We have many papers, especially the group of Evangelos Diatzikos from Patras, trying to define this high power laser really more efficient in terms of breaking the stone, and also defining this safe. But we have to take care, because all the energy that we put inside, we need to try to remove from the urinary tract. And if we consider the ureter especially, we can see that based on the kind of irrigation and the pressure of the irrigation that we have, we can decrease more the temperature. If we don't have any irrigation, the temperature during the lithotripsy is increasing really a lot. We have different ways to decrease this. First is increase the irrigation flow. Second, increase the space between the single pass, so the intermittent laser activation, and try to potentiate the cooling irrigation, the cooled irrigation fluid. And if this is not a problem at all in PCNL into the bladder, is a very big problem in retrograde venous surgery and in ureteroscopy. And I want to underline that it's very important, the setting of the laser. So we can use this burst lasing technique instead of the steady state technique, in order to allow the temperature to be decreased by this time that we leave to the water to decrease the temperature. And at the end, we have to know that we can increase the frequency, and in this way we can increase the working speed of our laser. But in the same time, we increase the temperature, but especially we increase this snowstorm effect that stop our vision, and consequently stop also the lithotripsy. So at the end, I like this slide presented by Vincent de Koning, in which one car with the same speed arrive in the same moment, that one car that is going faster but has to stop due to the vision not very good. And we have two different thermal vision. One is through the water, and the other one that is more dangerous is for the direct thermal effect on the mucosa. So we try to control the potency, but we try to control also especially the frequency, in order to have the maximum control of our laser. And as you can see in this slide of Olivier Traxel, we can use till 12-15 watts with low frequency in the ureter. We can increase in the bladder or in the kidney, depending on the instrument that we are using. And at the end, I want also to tell that TFL is not more dangerous than holmium. I think that we have to know exactly the different characteristics of the two different lasers, and based on the setting that we put, we can also avoid all the complications, especially in terms of high temperature and damage of the ureter, of the papilla, and of the mucosa of the upper urinary. So at the end, the The message is the knowledge of the features of our laser allow us to do a very good lithotripsy, to try to personalize the treatment based on the instrument that we are using and on the space, on the field where these instruments are used, having a very good result for the patient without any kind of complication. Thank you very much.